Today, with foreign and development ministers, we concluded important exchanges on two issues. How to engage more strategically with middle-income countries, what we call countries, development in transition countries. And we also focus on human development, discussing concrete ways to boost this part of development, human development. On the cooperation with middle-income countries, this debate was very timely because only last week we adopted the new Neighbourhood Development and International Cooperation Instrument, the so-called NDICI, difficult to pronounce, that we call it Gobal Europe. It's much better and easy. Well, this instrument will allow for a more integrated approach of our cooperation with these countries, with the middle-income countries, which have been heavily affected by the COVID-19 crisis. And we also exchange view on how to further support their recovery plans and share our vision for a green and sustainable recovery, which are underpinning our efforts. Then, on human development, this issue has regained a central role in the context of the pandemic. And our recovery efforts have to be addressed to global vaccine actions and concrete ways to drive development and innovation. We need an effective recovery. And in order to have this effective recovery, we have to step up our support, mainly for education and health. Education and health. And education and health, especially for women and youth. They are the key agents for change. And that's why we agreed to reach an ambitious target, allocating at least 20% of our official development assistance spending in the current budget period for human development and social inclusion. And we will do that working together as Team Europe, together European Union institutions with member states, to maximize our collective impact. This is going to be crucial for our contribution to enhance development results globally. And certainly vaccines and the vaccination process has also been an important part in our discussion. We discussed about how to further support COVAX. Let me remind that the European Union is one of the lead contributors to COVAX since the beginning. This is a way to ensure safe, fair, and equitable access to vaccines for all. It's very important because until now the vaccination process is very unbalanced. In Africa, for example, less than 1% of the population has been vaccinated, and in some Latin American countries the situation is really very bad. So we have to increase our efforts, and not only by donating, but to increase the manufacturing capacity. And the manufacturing capacity, the strength of the health system in partner countries, not just importing, but producing. And one of the ways is this Team Europe initiative announced by the President of the Commission at the last conference on the financing of the African economies, mobilizing 1 billion euros to increase this manufacturing capacity in order to provide access to vaccines, medicines, and health technologies in Africa. We have to think about how can we extend this initiative to other parts of the world, especially in Latin America. This has been the discussion today, very timely and related with very, very important questions.